Hi, I'm Dr. Sylvestre with Focus and Flourish. I've created this video on the steps to take when doing a bandage change because this is one of the most important parts of bandage management. And it's simple to say, well, we're just going to have a look, see what's going on, put a new bandage on and get the pet on their way. And that was always how I thought about it because, there's never enough minutes in a day. So let's just get this done. But then the fabulous technicians that I worked with would go, wait a minute, Dr. Sylvestre, I want to have a really good look over here and I really need to check this. And I will not rebandage until we've had a look at this. They have prevented my patients from developing a lot of huge bandage issues because they were proactive and they looked at things and looked into things and managed them before they were a big problem. I'm going to share their Bandage Check-in checklist with you. The first thing is the assessment. And it's not just about assessing the patient, but the place to start is to have a really good look and feel of the bandage before you remove it. Things you want to look at is, has the patient been chewing somewhere on the bandage, which might alert you to a problem? Has the bandage slipped or twisted? Was the bandage wet? All of these things you want to note. And then as we go forward, we're going to readjust so that these things don't happen again. Once the bandage is off, you're going to check the limb for dermatitis, cuts and wounds, as well as decubitus ulcers, or better still, decubitus ulcers that are thinking of forming, because prevention is always the best treatment. Dermatitis, that usually occurs if a bandage gets wet, if a bandage isn't changed often enough, but it could also be just because it's that particular dog. Maybe they tend to have a bit of a greasier skin. Cuts and wounds, look carefully, especially at the top of the bandage and at the lower end, but the top end of the bandage, sometimes if there's not enough padding, the gauze or the vet wrap can actually cause issues and cut the skin. Clearly is going to be treated differently than a dermatitis. And as we're talking about wound, the worst kind of wounds that we can see are the decubital ulcers. Ideally, you catch them before they develop. And what I learned from the technicians is they would go have a look at all of the places where decubital sores developing was a higher risk. And they would be looking for signs like the hairs are broken in that area. The hair is thinned out and maybe the skin's a little bit redder, even though the sore, the ulcer hasn't developed yet. Honestly, if you are not looking for this, you're not going to see it. You're going to miss it. So look for it. And if you know that's the case, then an application of a donut is going to do the job beautifully for you. Interdigital dermatitis, also a really big thing. And it could be very red and sore, or sometimes it might just be a little yeasty smelling and, we're kind of heading in that direction. So the goal is to look carefully, have a sniff test, see what you see how greasy that area feels, and deal with it appropriately. Now that the limb has been properly assessed, all the different issues that may be showing up need to be managed and then the bandage reapplied accordingly. So wounds, you're going to want to clean and manage appropriate. Use your favorite wound management protocol for these. Dermatitis, make sure that the skin gets nicely cleaned, maybe a Hibitane soap to wash it with, dry it really well. And maybe there's a cream or lotion that you like to use for dermatitis. Depending on how severe the dermatitis is, you may want to put the patient onto antibiotics. Make those decisions as you see fit for the patient. Hopefully we're getting to some of these problems early enough that we don't have to take big drastic measures. Interdigital dermatitis, again, it's best to get it before it becomes a full-blown problem. Now, if the dog has a very hairy paw, you may want to shave the hair back or cut the hair back that's between the toes, because the hair will help to hold the moisture and the yeast and keep the interdigital dermatitis going. Clean between each of the toes and dry them really well. We would take a blow dryer to get these toes dried if the patient would permit it. Be careful not to have the blow dryer on too hot, of course. You can apply powder in between the toes to help keep them dry longer, or some people will put some cotton in between those toes as well. Just something to prevent the skin on skin rubbing and to help absorb any bit of wetness and sweat that might be showing up. And then you're going to reapply the bandage. And based on what your assessment was of the bandage in the limb, when you reapply your bandage, you may want to make some alterations. You may want to place a donut. You may want to put a bit more padding and a bit more tension on this particular bandage if maybe there was some slippage in movements. And decubital ulcers will often show because of movement as well. It's a rubbing situation. These are all the types of things that you're going to take into consideration before reapplying the bandage. Finally, we need to reinforce excellent bandage care with the client. And there are many ways of doing this, but the first and most important is if there's a problem with the bandage, with the limb, you need to share that with the owner. We would do that by either inviting the client to be present for the bandage change, or if they're in the waiting room, we would go get them and show them exactly what's going on. And if they couldn't be, then we would take pictures. The pet owner needs to be part of the treatment team. Therefore, they need to know and understand what's happening so they too can adjust what they're doing to be able to do a better job at home monitoring the bandage. This next thing is a really important point. Book the follow-up recheck bandage change before they leave. Once somebody has an appointment, they tend to keep it. If the client says, "Oh, I don't know what my schedule is, I'll call you back with that." Nope, book it. Let them call you to change it, but at least it's booked. And at least they're going to have to do something about it if they can't make it that day, rather than just not show up. The recheck is important. And what should the timing of this recheck appointment be? A bandage should never go more than a week without being changed. At least checked, but most often changed. You may want to change the bandage sooner if you're dealing with a new wound, a fresh wound. And a week might be a long time to go. So you might want to see them in 24, 48 hours, depending on the stage of wound healing that the wound's at. Also, if you applied the bandage, or maybe it's a splinted bandage and there was a lot of swelling at the time, you may want to change that splint within a few days, 48, maybe 72 hours, because the bandage is going to help decrease that swelling. And when the swelling goes down, the bandage won't be fitting quite so well anymore. So you may want to switch it sooner. Also, clearly, if the client gives you a call and there's a problem with the bandage, then you may want to change it at that time rather than wait the entire week. But the rule of thumb, otherwise, if there's no reason to change it sooner, you change it on a weekly basis. I know it sounds frequent, and if you're a pet owner watching this, you're probably thinking, that's going to cost me a lot of money if I have to change the bandage every week. It'll cost a lot less money than having to deal with the potential complications that are going to show up if you don't do good bandage care. Before the client walks out of the door with their pet, make sure you re-educate them, you remind them, you reinforce what good bandage care looks like. And of course, if there was a problem, discuss it with them. How can they do things differently so that that problem doesn't show up again? Finally, I think one of the most important things is if a client doesn't show up for their recheck appointment, don't let it slide. Follow up. Give them a call. Send them an email. Hello, where were you? We missed you. We miss seeing Fluffy. It's really important that he has a bandage change. And document it. Document that they had an appointment and they didn't show, because that is the patient that's going to end up with a problem. And you don't want it to be your problem. This is a team approach. The owner has to play their as well. So no-shows are a big deal. Get on it. Don't let them slide. I hope you found this video helpful. Please hit the like button and subscribe to our channel.